The attendings, after they complete this type of course, will have this confidence that they can put in a bone bridge very easily, that they can think of alternatives to where to place the bone bridge. And then more importantly, what is the advantage of having full cochlear coverage, Odo plan, and the advantage of the cochlear implant from MED-EL, and the research that goes in behind it.
The first word that comes to mind is confidence. I think using the flex electrode can be intimidating, and so I think getting it in the hands, feeling what it can and cannot do, and just gaining experience can be a big confidence booster to be able to say, like, no, I can do this, I can push through this. And at the end of the day, it's taking away confidence that, like, listen, it's not as intimidating as one thinks. It's just with a little practice and a little experience, like, most people can do it.
I think over time what I've realized is MED-EL puts in a lot of effort towards the engineering, the background, the research. Electrode design is a very important aspect of their history, and it's clear in the way that they do their research and even try to be at the forefront of cochlear implantation that draws our group into wanting to be part of that future journey.